Welcome. This is part one of our four-part workshop series about Alzheimer's disease and caregiving for adults with Down syndrome and other intellectual and developmental disabilities. Each session builds on the one before it. And this recording is available for participants who are unable to attend in person or virtually. If you have questions after watching, please reach out to our team. Before we get started, a few things to note. A printed copy of the slides and a copy of the NTG-EDSD tool are available in your asynchronous materials. You will need the EDSD tool for part of our session, so please have it ready. Funder acknowledgement. A little bit about CASL. Founded in 1979, the Chinese American Service League is the largest and most comprehensive community-based nonprofit serving Asian Americans in the Midwest. With over 45 years of experience, CASL supports individuals and families across 4 essential areas: health, human services, education, and advocacy. From early learning and senior care to legal assistance, housing support, and citizenship services, CASL supports thousands of Chicago area residents build healthy, stable, and empowered lives. And these are just some of the services offered at CASL based on our different departments. Okay, here's the agenda. First, we'll go over the background of Alzheimer's disease, then we'll review some early signs and complete the EDSD tool. As for the stress management activity, that will be in a separate recorded video. Okay, let's start with the basics. Alzheimer's disease is a condition that slowly affects the brain. Over time, it changes how the brain works and makes it harder for a person to remember things, learn new information, communicate, make decisions, and complete everyday tasks. Alzheimer's disease causes a person to gradually lose skills and abilities they previously had. It is a progressive condition, meaning it gets worse over time. You may also hear the word dementia. Dementia is a general term used to describe changes in memory, thinking, and daily functioning. Think of dementia as an umbrella, and Alzheimer's disease is one type of dementia under that umbrella. It is also the most common type. Let's talk about why this topic is especially important for caregivers of adults with Down syndrome. We do not know all the causes of Alzheimer's disease, but research has shown a strong connection between Alzheimer's and chromosome 21. People with Down syndrome are born with an extra copy of chromosome 21, and this raises their risk of developing Alzheimer's disease or a similar dementia. Here's why. Chromosome 21 helps produce a protein that over time can build up in the brain and contribute to the changes seen in Alzheimer's disease. Because people with Down syndrome have an extra copy of this chromosome, they produce more of this protein, which increases their risk for Alzheimer's symptoms. It's also important to note that not everyone with Down syndrome will develop dementia, but because the risk is higher, it is important for caregivers to know the signs and start monitoring early. Now you might ask, at what age can we start to see signs of Alzheimer's or dementia for people with Down syndrome and other IDD? Well, in the general population, people typically begin to show signs in their mid-60s or older. However, people with Down syndrome age differently. Signs of Alzheimer's or dementia can appear as early as the late 30s or early 40s. And by age 40, many people with Down syndrome already have brain changes linked to Alzheimer's disease, even if they are not showing symptoms. Because of this earlier onset, it is very helpful to document a person's usual abilities by age 35. If they're older than that, start as soon as possible. Also, having a record of what is normal for that person makes it much easier to notice changes over time. This is exactly what the EDSD tool is designed to help you do. Okay, now let's review some early signs of Alzheimer's disease and changes you might notice if something seems different. For adults with Down syndrome, early signs of Alzheimer's are often changes in daily skills, behavior, or movement, not just memory. This is different from what most people expect, and it is one reason these changes can sometimes go unnoticed. Early signs may include less interest in spending time with others or sharing thoughts, less interest in activities they usually enjoy, trouble paying attention, feeling sad, scared, or worried more than usual, being irritable, uncooperative, or easily frustrated, restlessness or poor sleep, new seizures in adulthood, changes in walking or balance, and being louder or more excitable than usual. Here's a more concrete example. In a household where an adult with Down syndrome has help with simple chores like setting the table or folding laundry, an early sign of dementia might be that they suddenly need more help with these tasks or they forget steps they once knew. They may also feel frustrated or pull away during familiar family routines. These kinds of changes in daily functioning are often the first clues, and they're easy to overlook unless you know what to watch for. Okay, so why should we be more aware of the signs of Alzheimer's disease? It's important to pay attention for several reasons. First, many adults with Down syndrome may not bring up changes in memory or physical functioning on their own. They may not have the words to describe what they're experiencing, or they may not recognize that something has changed. As someone who knows them best, you are often the first to notice. Second, early detection helps identify when additional support is needed, such as before a crisis occurs. It gives families time to plan, connect with the right providers, and make informed decisions. Okay, if you notice clear or consistent changes in a person you support, consider seeking a professional assessment from a dementia specialist. This could be a neurologist, a psychiatrist, or a primary care physician who has experience with this population. There are tests that can check for changes in thinking and memory. However, these tests alone cannot diagnose dementia. Other health conditions which are common in people with Down syndrome can cause similar changes and should be ruled out first. Your doctor can help determine the right next steps and refer you to the appropriate specialist. One important point: only a doctor can diagnose Alzheimer's disease. The EDSD tool we're going to introduce is not a diagnostic tool. It is only to help you track changes you observe and document those changes over time. Okay, let's quickly review knowledge check. When do people with Down syndrome often show symptoms of dementia or Alzheimer's? If you said mid-30s to late 40s, you're correct. Next, what is one physical sign of dementia? You might notice changes in walking and balance. Last, who can diagnose whether a person has dementia or Alzheimer's disease? This would be a medical provider who specializes in dementia, such as a neurologist or a psychiatrist or even your PCP. So your asynchronous materials includes a printed copy of the EDSD tool. Please begin filling out pages 1 through 3 at a time when you can sit quietly and think carefully about the person you support. You may also ask other family members or caregivers who know the person well to help fill it out. The NTG Early Detection Screen for Dementia, or EDSD tool, is a checklist that caregivers complete to track a person's current abilities and notice changes over time. Here's how it works and what to keep in mind. It tracks how a person does everyday activities and how that changes over time, not just memory. It does not diagnose any condition. It is used to identify areas that may need more review. You can bring this form to medical appointments to help guide conversations with healthcare providers. Complete it once a year. If you notice concerns, update it every 6 months to track changes more closely. After completing, take a photo on your phone so you always have a copy available for appointments. The EDSD tool is available in multiple languages and can be downloaded from the NTG website. Here's a screenshot of what a sample looks like. Caregivers can go through each component and check off which applies. Your asynchronous materials include a printed copy of the EDSD tool. Please begin filling out pages 1 through 3 at a time when you can sit quietly and think carefully about the person you support. You may ask other family members or caregivers who know the person well to help fill it out. Pages 4 through 6 will be completed during workshop 2, so hold on to your copy and bring it to that session, or have it ready when you watch the workshop 2 recording. If you're completing this for the first time and the person is already older than 35, simply start now and use it to capture their current abilities. This becomes your baseline going forward. Here is a summary of the key points from this workshop. 1. Alzheimer's disease is a type of dementia that gradually affects how the brain works, including memory, communication, and everyday skills. 2. People with Down syndrome have a higher risk of Alzheimer's because they have an extra copy of chromosome 21. This does not mean everyone with Down syndrome will develop dementia. 3. Signs of Alzheimer's can appear as much earlier in people with Down syndrome, sometimes in their late 30s or early 40s, and often show up as changes in daily skills or behavior before memory loss becomes obvious. 4. Documenting a person's usual abilities starts as early as possible. This makes it easier to notice changes over time. 5. The EDSD tool is a helpful tool for tracking changes and supporting conversations with healthcare providers. It is not diagnosed dementia. Only a doctor can do that. Lastly, make sure you feel supported as a caregiver. There are multiple support groups and resources out there. Thank you for watching. If you have questions or would like to connect with their team, please don't hesitate to reach out to CASL's Brain Health Program. Thank you.